Hi, welcome to your first tutorial with the Keikku platform. Today, we are going to learn about how you can use Keikku Scribe. Keikku Scribe is a CE Mark Class I medical device developed to be a simple, accurate, and intentionally intuitive AI tool for clinicians. So let's start this first demo. Before you start this demo, you will need to have a subscription to the Keikku AI platform. You can subscribe for free on www.keikku.health. Keikku is Keikku.health. Now let's start. Here we are in the main dashboard, and the main dashboard has the options to review your patients via its library called My Practice, the Keikku Scribe function, which is under My Practice. It also has the reference AI bar, which is our evidence search tool in Europe, and contextual clinical decision support in the United States. For the sake of this demo, we will only use the scribe function. So let's start. To begin the session, click on New Session. You will open the scribe page. Here you can easily pick the microphones for your transcription. You can pick between the laptop, any other microphones, and if you have a complete account, the Keikku ambient microphones. In this case, we are selecting those. Then you can select the language that you will speak for this demo. We will select English in this case. Finally, you can select the template you will use. In this case, we will select a SOAP note. You can add or create a new patient just by clicking on Select Patient. In this case, we're going to select a predetermined patient just for the sake of this demo. Next, we will click Press Start by clicking the microphone, and your note will be transcribed. So we will start. Let's quickly give a test example to it. 45-year-old male patient arrives to the emergency room with chest pain that irradiates to his left arm. Patient is pale, sweaty, and feeling weak. We immediately transfer him to the emergency room, give him nitroglycerin, and perform an ECG. We realize he has ST segment depression and inverse T waves in his ECG. So we call the cardiologist to come to the emergency room while we take blood for troponin and other cardiac enzymes. We deliver the patient to cardiology and close the consultation. So now let's press on pause and then stop. And let's see how this note comes out. All right, so the note is ready. We press on go, and here we can see the note, the subjective, the objective, the assessment, and the plan. Exactly what we have spoken during our example. If your Keikku Clinical AI tool is connected to your EHR, you can push the note to the EHR immediately from here. So this was our scribe tutorial. I hope you enjoyed it, and see you next time.